Circling back to identifying disease using genetics, because you are trained as a medical geneticist, can you talk a little bit about your passion and your work at undiagnosed diseases, particularly in our most critically ill babies?
Absolutely. So that's been another big endeavor of mine since I came to Duke, which was working very closely with the neonatal ICU and Dr. Cotton here at Duke, who was very interested in basically bringing Duke to that next forefront of early diagnosis, rapid diagnosis in the neonatal ICU. And that had been, another big project that we launched together with collaboration with Rady Children's, who and Stephen Kingsmore's group, who had been advancing rapid diagnosis for undiagnosed children in these critically ill populations. And so we launched a pilot study that was a year long, and we were able to enroll 8 families into this study, and actually were able to show a 50% diagnostic yield, much to the testament of our astute clinicians here at Duke, who referred the right patients and really conducted strong and deep phenotyping of those patients to be able to get such good results, honestly. And so leading that effort has also been really rewarding to show that we can do this here at Duke successfully. And also what was fascinating and really exciting to me was that since that pilot ended, and these were all free genome sequences, so they were, on Rady Children's dime. And so we didn't have to ask the family to use insurance, money. We didn't have to ask the hospital to use money, but it showed obviously success. And since that pilot has ended, which it finished in July of 2022, we've seen a huge uptick in clinicians sending rapid genome sequencing or rapid exome sequencing, which is more clinically available and honestly very comparable in most cases. We've seen an uptick in that since July of 2022, about 1 every week or every 2 weeks, which is a huge increase from what we were doing previously. And I think it's just shown, that pilot showed everybody the value, the utility of using genomics for helping these critically ill infants get a diagnosis sooner, more accurately. And that also, of course, helps the clinicians care for them for a host of reasons. One example was, we found a STAC3 myopathy case that we diagnosed on rapid genome sequencing on the study. And then soon after that, there were 2 more diagnosed in the NICU, because it was a diagnosis that people hadn't maybe been thinking of. And it became something at the forefront of people's minds. And we indeed diagnosed 2 more cases soon after. And that diagnosis actually has implications for anesthetic management. And so it has a risk for malignant hyperthermia. So while it's nice to have the diagnosis, of course, it's also critical because these patients often go for surgery for a number of reasons. And to have the anesthesiologist know ahead of time that, okay, we need to use different anesthetics for this patient, that's crucial. So that's just one example of how it's been really helpful.